color is brown. We will assess the pupillary response to light by shining a pin light in the eyes. Patient looking straight forward. Eyes, the pupils are equal, round, reactive to light. For accommodation, I'll have the patient to look across the room at the wall. I will move my hand in toward the face. And now I'll have you focus on my hand as it comes towards your face. That was to test for accommodation and convergence. Now I'll have the patient cover her right eye. I will hold up a number on this side of the body and have her tell me what it is.
2.
And your other eye?
3.
That's correct. Okay. I'll test her movements of her eye, any conjugate gaze, by having her follow my finger with her eyes. Good job. Okay. Upon completion of that exam, we will do, before we move on, we will perform a Weber test by using our tool, placing on top of the head. Where do you hear the sound?
Both ears.
Okay.
Left ear. Right ear. This right ear. Left ear.
Well done. All findings are normal. From the eyes, we will move to the nose. The nose, we can assess the nose as midline and straight. There's no deformity to the nose. We'll also assess the patient's sense of smell, cranial nerve number 1, by asking if she can smell this candle.
Yes.
Any trouble smelling?
No.
Okay. Sense of smell is intact. We will assess her nasal airway patency by having her cover her right nostril, blow out the left. Okay. Nasal airways are patent bilaterally. Moving down, we'll move to the mouth. For the mouth, we can start with the lips and see that the lips are in a symmetric position. Curvature is normal. We'll assess for cranial nerve number 7 by having her raise her eyebrows, smile, frown, pucker your lips, and blow out your cheeks. Okay? Now, that is cranial nerve number 7. All movements were symmetric. We'll also test for cranial nerve number 5 by placing my hands over the TMJ, having her clench. All right, good job. Now open and close. Okay. There is no abnormality noted over the TMJ. Moving on with the mouth, we'll assess the teeth and the gums. No abnormalities noted of the teeth or gums. Have the patient to stick her tongue out and say ah. Uvula does rise and the palate is soft. That's cranial nerve 9 and 10. With the patient's tongue sticking straight out, we note that it is straight. It does not deviate to the left or the right. There's no deformities to the tongue. That's cranial nerve number 12. Now move your tongue to the right, to the left, up, and down. Okay? Patient's able to move her tongue as directed. From there, we will move on to the throat. For the throat, we will have the patient look upward. We'll assess that the trachea is midline by palpating. Her trachea is midline. We will then assess the carotid arteries. Carotid artery pulses are 2 pluses bilaterally. We will assess for any bruit with the bell of our stethoscope over the carotid artery. There is none. We will then move around to the back. We will palpate the thyroid gland. It is of normal size, shape, and a normal location. Upon our assessment of the throat being completed, we will then go to the posterior lung fields. Before we get to the posterior lung fields, we'll assess for any sort of respiratory distress. There is none noted. There's no tripod breathing, no use of accessory muscles, no tachypnea, and no nasal flaring. So what we will do now is, if you'll stand and then remain seated facing away, we'll assess the back for any tactile fremitus and for chest rise. First, for tactile fremitus, we'll place our hands on the back. Take a deep breath. And again. There is no tactile prematous. I'll place my hands on the back like so. Take a deep breath. There is good chest expansion. From there, we will also note that the chest is symmetric. What I will do now is I will auscultate with the diaphragm, my stethoscope, start above the scapula. Take a deep breath. Okay. And for the bases. And under the right arm for the right middle lobe. Again. Okay. Breath sounds are clear and equal bilaterally. We will also, now we will percuss between the intercostal spaces. Okay. All findings from the percussion were normal. I will now have the patients turn around. Prior to having our patient turn around, although she has turned around, we will do it this way. I'm going to assess for bronchophony and egophony by placing my stethoscope to the patient's back and having her say 99.
99.
And E.
E. 99 E. 99 E. 99 E. 99 E. 99 E.
Okay, all findings are normal. Moving around to the front, we will assess for tactile fremitus, placing our hands on the chest, deep breath, and again. There is none. We'll also assess for chest rise. Take a deep breath. There is good chest rise. Her chest is equal and symmetric from the front. We'll now assess for breath sounds by starting in the upper lobes. Take a deep breath. Again. And the bases. And the right middle lobe. Okay. Breath sounds are clear and equal bilaterally. Upon completion of our auscultation, we will then auscultate again for bronchophony and egophony by having the patient say 99 and then E.
99 E. 99 E. 99 E. 99 E. 99 E. 99 E.
Well done. Okay, upon completion of our respiratory assessment, we will then move on to our cardiac, where we will auscultate in 5 different locations in a Z pattern, starting from right and moving left and downward. We will listen first to the atrial, the pulmonic, Erb's point, tricuspid, and mitral. Mitral is our point of maximum impulse. We will here we will determine our patient's heart rate and rhythm. Patient's heart rate is 72 beats per minute and is a regular rhythm. From there, we will turn our stethoscope over to the bell. We will listen for any sort of murmur, atrial, pulmonary, pulmonic, Erb's point, tricuspid, mitral. No murmur or extraneous cardiac sounds noted. Okay, from here we will have the patient to lie down. Upon lying, there is no JVD present. While the patient is supine, we will auscultate our breath sounds again, starting with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, mitral. And flip to the bell, aortic, tricuspid, and mitral. There are no extraneous cardiac sounds noted, no murmurs. S1 and S2 is present. Patient's heart rate is 72 beats per minute and is regular rhythm. From here we're going to move down to the abdomen. First we'll start by noting the abdomen is flat and symmetric. Her skin is warm, dry, and intact. Normal for ethnicity, good skin turgor. We'll start by palpating lightly with our light palpation, starting in the right lower quadrant, moving up to right upper, over to left upper, and left lower. Now we will deeply palpate right lower, right upper, left upper, left lower. We will also palpate for the liver in the right upper quadrant and the spleen in the left upper quadrant, which will not be palpable. The patient's abdomen is soft and non-tender as well as symmetric and flat. We will then listen for bowel sounds in all four quadrants, starting with the right lower to the right upper, to the left upper, to the left lower. Bowel sounds are present and normal active in all four quadrants. We'll flip over to our bell and listen for any sort of bruit over the abdominal aorta, the renal arteries, the iliac arteries, and the femoral arteries. There is no bruit noted. Allow the patient to sit up.
It's normocephalic. I'm going to palpate your scalp. Let me know if you feel any pain, okay?
No.
And I don't feel any lumps or masses, and I also check for infestation. And the hair is clean and shiny. No infestation present. And next I'm going to check the symmetry of your face. I'm looking at your eyebrows, eyelids, nasal-fabial folds, and the margins of your mouth. Everything looks symmetrical. And can you smile for me? And can you frown? Okay, so cranial nerve number 7 is intact. Okay, next I'm going to check your vision acuity, your cranial nerve number 3, 4, and 6 for intactness. Okay, so I have this pen. You just follow the tip of the pen. Okay.
Mm-hmm.
And I check for the accommodation. You follow the tip again. I'll bring it towards your nose. And the pupils are constricting and coming together. Okay. Next I'm going to check the pupillary light reflex. So pupils are equal, round, and reactive to light and accommodation. I'm going to check your sclera and conjunctiva. Sclera is white, conjunctiva is pink. And I move forward to check your temporomandibular joint. Can you open your mouth? Do you feel any pain? And I also didn't hear any crepitism or clicking. And I will palpate your maxillary sinuses. Any pain?
No.
And frontal sinuses.
No pain.
Okay, and take a look at your nose. Is at the midline. Septum is at the midline as well. I'll palpate it. Do you feel any discomfort?
No.
Okay. Check the nostril patency. Can you cover one nostril and breathe to the other and do the same thing? Any discomfort with that?
No.
Okay, that's good. Next I'm going to palpate your ears. They are symmetrical. I don't feel any lumps. I don't see any lesions. And I don't see any serum present. Did you feel any pain with that?
No.
I'm going to check your cranial nerve number 8 intactness. I'll whisper you something and you say it back to me, okay?
Mm-hmm.
Fall semester almost over.
Fall semester almost over.
Okay.
Yeah.
Beautiful plants.
Beautiful plans.
Okay. Thank you. Next I move forward to check your mouth. I can see that your lips are pink and moist. And I'll ask you to open your mouth. Your teeth are white and all are present, and the gums are intact. I'm going to put on gloves and check the hard palate, soft palate, tongue, tonsils, and the uvula. I'll just touch with my finger, okay? So I need light to see. Okay, open wide. Okay. Can you bring your tip of the tongue up? Okay, stick your tongue out. Okay, good, thank you. So your dorsal part of the tongue is white, pink, white and rough. Bless you.
Thank you.
And underneath your tongue is pink and shiny. Your buccal mucosa is intact. And can you say, open your mouth and say, ah?
Ah.
Okay, uvula and tonsils pink and intact, no inflammation present. And next I'm going to palpate and check your glands for any inflammation. Check the parotid gland and salivary gland. And at the base of the neck, the thyroid gland. No inflammation present. And I'm going to check the lymph nodes, okay? I'll press. Let me know if you feel any discomfort. Preauricular lymph nodes, postauricular, occipital, submental, submandibular, jugular digastric, superficial cervical chain, deep cervical chain, posterior cervical chain, and then the supraclavicular. Can you shrug your shoulders? Okay, good. No abnormalities found. And next I'm going to check the intactness of cranial nerve number 11. Can you shrug your shoulders and press against my hand, against the other? Okay, thank you. And next I'm going to palpate your carotid pulses, okay? Okay. Strength is 2+, rhythm is regular, and rate is between normal limits. And I also going to auscultate with the bell of my stethoscope. And for that I'll ask you to breathe in, breathe out, and hold, okay? Again, breathe in, out, and hold. Okay, thank you. No abnormal sounds or breath present. Next I'm going to inspect your upper extremities. I take a look at your arms. I don't see any lesions present, bruises, pallor, redness, and I check the temperature. Your skin is warm and no edema present. And I also check your radial pulses. They are symmetrical, regular, strength is 2+, rhythm is regular, and rate is within normal limits. And I'm going to check your fingernails for capillary refill. And I can see that the capillary refill is less than 2 seconds. The nail beds are pink, and the nails are firm. I'll check the profile sign for each nail. It's less than 160 degrees, which is normal, no clubbing present. Okay, so I'm going to check the strength in your arms. Can you bring your arms up on your back? Okay, put your hands like this. Bring them up. Put your fingers like this. Okay, pull towards you. Okay, press against my hands, okay? Squeeze my fingers. Okay, thank you. And then I'll check your elbow strength. Can you put your arms like this? Okay, pull towards you. press against my hands. Okay, good. And next I'm going to move to inspect your chest. Your chest is symmetrical in front, normal respiration movements, symmetrical in the back, no abnormal movement, no palpitation. I'm going to listen to your lungs, okay? And you breathe deeper than normally, okay? Through your mouth. I'm also going to auscultate in your back. Okay, so I could hear the bronchial sounds up here, bronchivesicular at the middle, and at the base of the lungs, vesicular breath sounds. And next I'm going to auscultate your lobes. Can you lift your arm up? Okay, so I have to auscultate like 2 lobes on the left side. Breathe deeper. Thank you. And then 3 lobes on the right side. Okay, thank you. Next I will check your jugular vein.
Okay?
I see it. I see it. I see it. I see it.
Okay, peripheral vision is intact.
Mm-hmm.
Okay? Now I'd like you to follow my finger.
Mm-hmm.
Okay? Okay, corneal field tests within defined limits.
Mm-hmm.
Okay. Okay. Okay, red reflexes, clear bilaterally. Okay, pupils are equally round, reactive to light, and accommodate. Okay, I'm going to take a look at your ears. Ears are intact, no lesions in external ear, no disformity noted. I'm going to touch your ear. I want you to tell me if you feel any tenderness, okay? Tenderness?
Mm-mm.
Tenderness?
No.
Tenderness? Tenderness?
Mm-mm.
Okay. Bilateral ears is non-tender. I'm going to take a look at your ears. Tympanic tympanic membrane is intact. Cone of light, right ear, 5 o'clock, and left ear, 7 o'clock. No discharge in bilateral ears. Okay. I want you to tell me where you hear, if you hear the sound on one side or both sides, okay?
Hear on both sides.
Hear on both sides, okay? Now I want you to tell me when you stop hearing it, okay? When you stop hearing the sound, you don't hear any sounds anymore.
Okay. Stop hearing. I stop hearing.
Okay, no sensory or conductive hearing loss. Okay, nose is symmetrical in appearance. No inflammation, no watery discharge noted. Okay, appears midline. I want you to occlude one side and take a deep breath. Okay, and the next side. Any difficulty breathing?
No.
Okay. I'm gonna take a look inside. Tilt your head back for me, please. Okay. Okay, nasal mucous membrane is pink, intact, no polyps, no lesions, no perforations noted. Okay. Mouth appears symmetrical, intact, lips are pink. Okay, I'm gonna ask you to open your mouth for me and stick out your tongue. Ah.
Ah. Ah.
Okay. Tongue is pink and moist. Oral membrane is pink and intact, no lesions noted, no skin breakdown. Say ah, stick out your tongue.
Ah.
Uvula is midline. I want you to stick your tongue on one side and then the other side. Okay, no lesions, no breakdown noted, no oral cavities. Okay, lift your tongue backwards for me. Okay. All right, look straight at me. Look straight at me. Okay, I want you to tell me if you feel any tenderness.
No.
You feeling tenderness?
No.
Okay. Tenderness?
No.
Okay. Tenderness?
No.
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 Okay. Tenderness?
No.
Okay. Lymph nodes are non-enlarged and non-tender. Okay. Neck. I'm going to take a look at your neck. I'm going to tilt your head back for me. Okay. Any tenderness?
No.
Any tenderness?
No.
Okay, I want you to swallow for me. Okay. I'm going to turn around behind you. I'm just going to feel. Okay. Okay. Swallow for me. One more time. Okay. Trachea is midline. Thyroid gland is within defined limits. I'd like you to look at your chest. Would you mind taking your shirt off for me? Okay. All right. Suprasternal nosh. Okay. Okay. Right. Chest is symmetrical. Breathing is even, unlabored, no retraction noted, and no use of accessory muscles. Okay. I want you to breathe in for me. Breathe out. Okay. Breathe in. Breathe out. Okay. Chest expansion even. I want you to say 99 for me. Okay. And don't stop until I tell you. Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. I'm going to touch your chest. I want you to tell me if you feel any tenderness, okay?
Mhm.
Tenderness?
No.
gonna take a look, listen, your lung sounds.
Mm-hmm.
First, I'd like you to say E for me, okay? Go ahead.
E, 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 E,
Okay.
E, 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 E.
Okay. And now I'd like you to say a sequence of numbers for me. 1, 2, 3.
Okay.
Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Okay, Broconphony, aconphony, and whisper, particular, not present.
Mm-hmm.
Okay? I'm going to listen to your lung sounds. I'm going to ask you to breathe in and out for me.
Mm-hmm.
Okay. Same as before, I'd like you to ask you to breathe in and out for me.
Okay.
Okay, lung sounds clear in all lobes, no adventitious sounds heard. Okay, and that completes our exam. Thank you for allowing me to examine you.
Thank you. I appreciate it.